Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're looking at Guillain-Barré syndrome, or GBS, the most common cause of sudden nerve-related weakness and paralysis. It can strike quickly, often after an infection, and in severe cases may even affect breathing. But with early treatment, many patients recover. So you're going to want to know, what is this? You probably haven't even heard about it. So to help us, I'm joined by my colleague, Dr. Bryn Henderson, a board-certified physician and leader in regenerative medicine. Dr. Henderson, thank you for being here.
Well, thank you for having me. My privilege.
Well, let's start. What is Guillain-Barré syndrome? Am I even pronouncing the French correctly?
Wow. Guillain-Barré is an autoimmune disorder where the body's own immune system mistakenly attacks the nerves. We've seen them that attack the lungs. We've seen them that attack the vessels. This one attacks the nerves. It usually begins with tingling and weakness in the legs, spreads upwards, and can progress to paralysis. The pattern is extremely important. Patients often lose reflexes, and about a quarter of the patients need help breathing later on.
All right, let's divide up the types of GBS.
Okay, there's several forms. The classic is the most common, and it is those that have damages to the protective covering of the nerves called the myelin. It slows down the signals. The motor form of this is mainly affecting the movement of the nerves, often after certain infections like food poisoning, and it's seen often in Asia and Latin America. A mixed form, this is a more severe version. It damages both movement and sensation. So that would be motor and sensory. The Miller-Fisher syndrome, a rare type that mostly affects the eyes and balance, these patients have double vision, trouble walking, and loss of reflexes.
All right, so let's talk about triggers. What triggers Guillain-Barré?
Oh, about 2/3 of the cases, the patients had a recent infection. So it's common to be post-infection, often a stomach bug or simple respiratory infection. The most common trigger, it's a bacteria found in uncooked poultry. And the immune system mistakes the nerve proteins for the infection and starts attacking. And this is called a molecular mimicry.
Do genetics play a role?
Absolutely. Genetics have a sporadic role most of the time, but they definitely are linked to multiple affected members that have a genetic, what they call predisposition. So certain immune system genes may increase the susceptibility.
Let's now talk about traditional Chinese medicine. How do they look at Guillain-Barré syndrome?
Well, like in most things with TCM, it's a question of balance, and it falls under the flaccidity syndrome. That's thought to be caused by a weakness of the vital energy, the key, with invasion of external factors like wind and dampness. Acupuncture points are often used to boost energy and restore movement, and herbs are often used to improve circulation and reduce inflammation. Some studies suggest that combining TCM with standard care may improve recovery as well.
How do you diagnose it in your office?
It's a clinical diagnosis, so we absolutely note the pattern as stated, but we base it on rapidly worsening weakness, loss of reflexes, and symmetry of symptoms. Supportive tests, spinal taps, which show high protein, are rarely done in our office, but they're done in hospitals, and sometimes neurologists do them in their office. Nerve conduction studies, likewise, often confirm the damage to myelin or axons. Blood tests detect antibodies. So it helps us with specific subtypes.
So, what standard of care treatment now in the United States?
Well, without a doubt, the mainstay is intravenous immunoglobulins given over 5 days to neutralize harmful antibodies. These are given in offices and usually under pretty close scrutiny for side effects. The plasma exchange, another one, is called PLEX, is a process that filters out those antibodies from the blood. Both shorten the course of the disease and, if started early, help. Steroids are not recommended. Patients often need supportive care, including respiratory monitoring, physical therapy, and, of course, blood clot prevention.
Well, what about regenerative medicine? There has to be new therapies now.
You're absolutely correct. Most are still in their very early stages, though, because these help by calming inflammation and support nerve repair. There's even peptides that grow myelin sheaths. So there's absolutely innovation. PRP, the platelet-rich plasma, contains growth factors that help the nerve healing as well. It's very promising. The acupuncture and electropuncture are studied as adjuncts, sometimes showing motor improvement, but evidence remains very limited.
Let's talk about lifestyle strategies for our patients.
Well, that's good. Lifestyle is critical, of course, because you've got to get nutrition there for proteins for sure, vitamins, Bs, and others, and omega-3s help the nerve repair. Rehabilitation, gradual physio and kinesiology, and breathing exercises aid recovery while avoiding overexertion. The mental health, as in most, have to address the anxiety and depression that are common when dealing with such major illnesses. Counseling and support groups make a big difference and are very successful. Prevention of complications, good skin care, mobility exercises, and infection prevention are essential.
So, what are we talking about long term with someone who's been attacked? It sounds like an attack. You have an infection and then your nerves get attacked of Guillain-Barré.
Well, and it is an attack and it's progressive. If that's seen, then we better act very deliberately. And most patients, if we do, recover with the ability to walk within 6 to 12 months. But about 20 to 30 of them may have a long-term weakness, pain, or fatigue. The mortality is low, but the comorbidities, the other illnesses that are caused by it, are high. A small percentage relapse or develop a chronic form called chronic inflammatory polyneuropathy. That means you have inflammation of a whole bunch of nerves for a long time. So you have to follow up with a multidisciplinary team to be successful.
What's your mnemonic?
The mnemonic here is nerves.
N stands for?
Nutrition rich in protein and vitamins for nerve repair.
E.
Early treatment with IVIG or plasma exchange.
R.
Rehabilitation with physiotherapy and breathing exercises.
V.
Ventilation support when breathing is weak.
E.
Emotional health, counseling, and support groups.
And S.
Safety measures to prevent infections and blood clots.
Well, thank you, Dr. Henderson, for taking us through Guillain-Barré syndrome, a condition that can be frightening, but with early treatment, as you taught us, and proper care, most patients recover. If you or someone you know develops sudden weakness, paralysis, especially after an infection, seek medical attention immediately. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, Go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pensanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.